Answer to these questions, but they're ones that I hear most frequently.
Okay.
So credibility of the number of interviews.
Yeah. We'll be addressing that, don't worry.
Who, why, live, work.
That is also a good question.
Again, these are questions that I hear more than mine. What will the pilot look like, and when will it start impacting me and my job?
So these were the 3 original goals that we started the project with. So enable St. Nicholas to affect the lives of more people in providing support for those experiencing dying, death, and bereavement, increasing cost effectiveness of service activities, and then establishing metrics and measure quality of experience of life, experience in the final chapters. And this is where there's lots of different levels here, and we'll get into the details of this.
But it's about, you know, still driving forward with the vision of the charity, which is still Richard's vision that he set all those 34 years ago. It's doing it in a way that's sustainable and cost effective, that we don't run out of money and we won't be able to do it in 10 years' time. But it's also being able to understand better, which is something hospices aren't brilliant at, is that it's working and it's cost effective and it's the right thing to do. We shouldn't be doing things that aren't the right thing to do and aren't working. And I think that's the cycle of evaluation and quality that we need to, that we do a bit. I'm not saying we don't do it at all, looking at Deborah and her committees and the evaluations that we do and everything, but I don't think it hasn't made us change very much. So I think this is really important.
And so really this is what we were talking about before, is service design here is about changing how you're changing, and a different mindset, a different approach, a different rhythm. So right now we're sort of in a really big cycle of change, and then eventually there will be a sort of evening off point where there'll be smaller circles of change and keeping that momentum going.
Because, you know, the whole learning this approach and doing this approach should achieve the objectives we're setting on an ongoing way. But on the other hand, what we want it to do, which is even more important, that over the years now, that when everybody is running, whether that's a community service, bereavement service, retail, out, you know, working with the community in the shops, that everybody starts thinking, well, you know, we're doing it like this, but actually the feedback we're getting from our customers who are walking through the door, I wonder if we could try doing it like that. Well, why don't we try it like this? And how are we going to get feedback? So actually what we want service design to do is influence everything we're doing, sort of from fundraising to retail to services to bereavement care, that it sort of becomes, you know, part of your one-to-ones, and that, you know, that you're always just thinking, well, could we do, you know, could we do that a bit better? But then when we're doing it, how do we check that out? How do we get the feedback? How do we measure it? How do we cost it? I know that's making, but you know, you don't want to change how a shop works without knowing whether it works. And I know retail has a new strategy now, but all that's going to be measured and tested. So it is, on one hand, there will be, I think in a couple of years, we'll know the shape of it. We'll know the handlebars, the different brakes. We'll know how many stabilisers we need, whether it's front and back or just back. You know me and my metaphors. But then also we'll know, you know, how it's working and how we're going to do it, and that we're always going to be tweaking and adjusting, and improving.
So this we just wanted to sort of hint at, like how we're usually set up projects is the client gives us a brief. I mean, we're consultants. The client gives us a brief. We might do some research. We come back and tell them what we found. We then develop concepts. They help us prioritize. We learn a little bit about their business. It's very much that consulting model. It depends on the project. I mean, this is sort of like the complete opposite almost, is that you guys are the ones, you've done the interviews, you did the synthesis, you did the prototyping. We're helping with, you know, visual design skills and also the process and also the, you know, the methods and tools, but it's really you owning this. It's you driving around to people's homes and interviewing them and gathering that insight. And it's really been a process that you've owned, and we've, you know, sort of as much as possible worked together and also defaulted to your decision is always kind of the final one. It's not, we're not dictating this process at all. So we really view this as a partnership, and definitely a long-term one. It's something that, it wasn't, oh, we'll do 6 months and then see you later. It's a continuing thing, which is why back to the hospice.
People in need, if they weren't in need, they wouldn't need us.
Facts are facts.
And we put everyone involved.
The staff's education, family support, expert clinical knowledge, and the patient contact database.
Yes. What else?
What is it?
Enabling communications.
Absolutely.
Police,
I'm going to have to say
being
deaf literate.
She does. Encouragement, kindness, respect, understanding, listening, treat people how you want to be treated.
So are we doing, we're doing this
What is this? Hang on, is that the stage? No. So when we're thinking about the process.
Potentially, there's some good businesses who were really sold on this.
So I always talk about it.
We've got 4 ourselves. Yeah. Shall we go into it?
The end of September, 3 things we've done: education mapping, key stakeholders, recording community data, identify business community.
We also need, between next week and the week after, we need to identify who are the people that will help us to test the tool.
Looking at, but certainly by the end of September, defining our expertise, unpicking what is our expertise. Okay. So work session 10 was a really good day. We brought together a group of people who hadn't been quite so closely involved with service design over the last few months, and just as a reminder of where we are and how we got here, we had a really good discussion about public health approach to palliative care and around deaf literacy as well. We also worked on the plan for between now and to November for the pilot, the start of the pilot. It was great that so many different people were involved across the organisation, because I think the important thing to remember for us all is that service design needs input from all of us, whether you're from the clinical team, the fundraising team or the catering team. We all need to be involved in this.